So in this segment, we're going to be discussing Wes Streeting getting cooked by members of the public or medical professionals over his actions around funding. And we're going to talk about this idiot again as well, Ali Maraj, because he annoys me. So let's have a listen to what the nurses had to say.
Tracy, what did you want to ask Wes Streeting?
Wes, hi. I'm sure you're aware of a paper from The Lancet by Benjamin Goodhair, challenges justifications for healthcare privatisation and concludes that scientific support for healthcare privatisation is weak. Overall, hospital privatisation may reduce cost, but it does so at the expense of quality of care.
So it makes sense that they would reduce quality because that's where they make the profit. So, that's where, you'll have, instead of GPs, you'll have other people, physicians, associates, or whatever they're called, looking at people in order to save money because they're way cheaper than having a GP. And they're, by doing that, the patient suffers.
The question to you, Wes, is when NHS services are privatised, what is the benefit to the patients and their communities? And could you give me examples of where privatisation of previously publicly owned services have been a success?
I'm not interested in privatising the NHS. In fact, I've said many times now, we'll privatise the NHS over my dead body. So we will, as a point of pragmatism, use the private sector to bring down NHS waiting lists. That is not the same as privatising the NHS.
So when you say, and you've said it many times before, free at the point of use, your intention is to keep the NHS free at the point of use for individuals whenever they need it.
Yep.
That isn't the same. I mean, it's a laudable ambition, and I'm sure most people support it. But it isn't the same as saying there won't be further privatisation of the NHS, is it? Services being privatised, tendered out to private companies. Those two statements aren't quite the same thing.
No, I mean, that's why I always say I want an NHS as a public...
We saw under the Tories, it was still free at the point of use for most things. Dental and eye care are not covered by the NHS, but haven't been because they scrapped it a long time ago because the country was broke and couldn't afford it at that point. So that one's fair. But for most things, even under the Tories, it's free at the point of use. The only problem was the healthcare system is washed because you can't get appointments, and A&E wait times are a joke, or still are a joke, amongst other things. So, to make the argument that, you want to keep it free at the point of use, and therefore it's not privatisation, like you can do both things. That's the thing, because, at the end of the day, people are paying through taxes for healthcare. So, you can keep it free at the point of use. But, the caller's point was you're letting the private sector in. And the problem with the private sector is, you get lower quality of care.
Service, publicly funded, free at the point of use. And those three bits are important.
But with the public elements around the edges.
Public service, publicly funded. I would prefer those public services to be within and provided by the public sector. But I've got to deal with the NHS as it is, not as I would wish it to be.
And I would want to see where his assessments are in terms of what, why the public sector have to be used in certain areas. Because most of the time, they're still NHS employees. They're just freelancing or, moonlighting in the private sector because they probably don't get paid enough. Or it's just, they can make lots of money through working as agency staff temporarily. So I would love to see the actual data he's looking at, the information he has, because he's been saying this for a while now.
Does that reassure at all, Tracy?
Pardon, does that reassure me? No, not at all, because there is already privatisation within the NHS. There are many services within the NHS that have been outsourced to private companies, and Wes has put no proposals forward on how he proposes to reverse that. Currently, we have £10 million per week since 2012 going out to the profits of private companies. So, Wes, you can't sit there and tell me that your plans are, to keep a publicly funded NHS when they are sucking £10 million out per week.
£10 million per week is crazy. Imagine where, how far that money could go into certain communities, into certain hospitals. That would do tremendous amounts of change. And there's more. I think it's the same caller. Yeah, it's the same caller. But she goes on a different angle.
If you say that you're not interested in privatisation of the NHS, could you please explain then since 2015, when you entered Parliament, there's been more than 60% of the money that's been donated to you has come from companies and individuals with links to private healthcare. Now, as a nurse, Wes, I'm only allowed to accept trivial gifts from patients such as chocolates, okay? Because it could be seen as a conflict of interest. Can you tell the listeners what your donors are receiving in return for their donations and how?
It's kind of crazy, isn't it? Like, you see someone who actually works in the field and they can only receive minor gifts for, you know, the services they give out to patients in terms of, you know, saving lives effectively. And then you've got this geezer here can take money, you know, tens of thousands in donations, or bribes, should we say, what they really are, and there's no consequence.
How the public can believe you that this is not a conflict
All
of
right,
interest.
well, let's
So I'd say two things. The third thing I just want to say is on Tracy's point about political donations. I mean, firstly, the people who've donated to me, I mean, there's been such a stretch with some of the, I think, deliberate misrepresentation we see online between people who've donated to me and links to the private sector. For example, one of the people who've donated to me in opposition to fund staff in my office was involved in a recruitment company. Now, that recruitment company, according to people who've kind of dug into it, does some health recruitment.
Surely you should be digging into it if you're taking money from them, no? In terms of making money from health recruitment, yeah, it's in their interest that the NHS still takes private contracts and still has these kind of agency staff, because they make money through the fees and through the salaries the agency staff earn. It's not hard, Wes, honestly. The fact that these internet people have done more research than you have is an abomination.
I think that's such a tangential link, but you would think, reading some of the things, and actually, to be blunt, listening to Tracy, you'd think that I was taking loads of donations from Bupa, and I think that is willful misrepresentation. Given
the kind of connections you seem to have with Eli Lilly, mate, you know, I'd be careful what you're saying here, G.
And the final thing I'd say on political donations, as there's obviously been a lot on this in recent months, those newsletters that come through your door, the staff that work for political parties doing campaigning, the election campaigns that you've been subjected to quite a lot over the last 9 years, they all have to be paid for. Now, we could take the approach that other countries do of having state-funded political parties.
Which is correct. This is what we should be doing. So taking money from oligarchs and big business, we should be taking money. It should either cut the amount you can donate to literally £100 max, or make it publicly funded. Make publicly funded elections. I'd rather see that, because that'd be a much more level playing field for all involved.
We all pay a levy, or we pay through our taxes for political parties. I don't think, listeners might correct me if I'm wrong, I don't think people want to see their taxes used to fund politics. Therefore, we do have to raise money.
Why don't you ask the public? Have you ever asked the public about this? If that's what something the public want? Because I'd rather have it so that, you know, I'll pay more in tax for this. I mean, we pay. You can claim staff on your expenses anyways. Why are you claiming? You know, why do you have so many members of staff when, you know, Parliament will help fund that? You know, we've had endless stories of politicians who hire their significant others or their kids to staff in their offices. So you're telling me that you couldn't have done that? Not saying family members, but saying get people on who are competent within your team, hire them in order to staff your office. You can do that. You needed a big business to do that for you. Get out of here.
And in direct response to Tracy's question, what do my donors get for donations? Well, they get a Labour MP in Ilford North and a Labour government, and they get nothing else in return.
That's cap. That's straight cap. Especially when he's the one talking about, you know, using more private companies within the NHS in order to clear the backlog. That's cap. Straight cap. Because if we wanted to get these machines or whatever, they could easily buy them. They could buy them. They could either buy it off the private companies and say, look, you're not going to get any more business your way anyways. You might as well sell these to us, or buy the machines. You know, you tell me the government, you tell me the seventh richest economy in the world can't buy more scanners and that kind of equipment. Get out of here, honestly. And we go to the biggest genius on LBC, a man who eclipses Nick Ferrari in his analysis.
When you say that Wes Streeting quite rightly has talked about community-based provision of healthcare, what on earth do you think he's been smoking? And I thought they were banning smoking initially in pubs, which they've abandoned now, but they're thinking about it outside hospitals. What do you think he's been smoking with Rachel Reeves, when on the one hand they're giving 22.6 billion to the NHS in additional funding, but they're imposing an increase in employers' NI that's going to affect companies like yours?
So with the employers' NI, I don't know if that's the right measure to go down. I've seen John McDonnell, I've seen a lot of other people criticise it, and, you know, business owners have complained, which obviously they're going to do. but I think it will push some of them under, and it will push significant price rises and staff cuts. But what I will say is, like my guy, yeah, do you think that workers don't use the NHS? You know, do you think employers want employees who are ill all the time because they can't get GP appointments or can't get routine operations done? So they can't do their jobs. They're going to be on sick pay for a while, or they're going to be working at 60 or 70% rather than, you know, at their maximum productivity. Do you realise one of the major reasons we have, I think, a productivity crisis in the UK is because of long-term sicknesses and things like that, because people can't get basic care in this country. Absolute moron.
I mean, it's an absolute nonsense of a budget. It's quite clearly there is absolutely no business sense being applied whatsoever to the budget. They're not joining up the dots. You know, they're giving the rhetoric that, you know, the community wants to hear. But in practice, it's going to do the absolute opposite.
Dear, oh dear. Best your thoughts with you, with your team as well on navigating it. Lucy, thank you.
Yeah, this man's on fraud watch right here, honestly. But in terms of, you know, Wes Streeting getting booked, you know, he did by that nurse. And yeah, more power to her. But anyways, I'm going to leave it there. Let me know what you think in the comments below. Like, comment, share, subscribe. Support the channel on Patreon if you can. And hopefully I'll see you in the next one.